Okay, here's a demonstration of the CPR practical exam video that you're going to have to submit to me for a grade. Now make sure that you print out the rubric and you kind of follow the steps on the rubric, and I'll be grading you according to those items on there. And it's very simple. Points are assigned for each thing that you perform. So I'm going to go through those for you and kind of walk through it fairly quickly as if I were to submit a video. Okay? First and foremost, check the scene. Scene is safe before I approach for my own safety. I am not going to approach a victim that is in a dangerous situation because we don't want multiple victims. Second, I approach, I have to check responsiveness and check for breathing. Hey buddy, are you all right? Can you hear me? Hey buddy, you all right? Checking responsiveness. No response, I'm checking for breathing. Look, listen, and feel. Looking at the chest, listening for any breathing sounds, and feeling any hot breath that may be on my skin. If they are unresponsive and not breathing, I'm going to call 911. Hey, go call 911. Or if I'm alone, I'm going to have to go get them myself. Go get help first, then come back and start. Now this is an adult victim that we're talking about. When you begin the CPR, find the middle of the chest. The nipple line is what I'm going to ask you to say and to kind of identify. Heel of the hands on the nipple line, and then you're going to bring in 30 chest compressions, and you're going to have to complete those 30 chest compressions in 18 seconds. Now, here is a cue. If you use the song Staying Alive by the Bee Gees from Saturday Night Fever, 1, 2, 3, 4, 5, 6, 7. It's the perfect rhythm so that you can get it accurately. I'm actually going to time you when I am checking your video. I'll give you an example. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 5, 6, 7, 28, 29, 30. Make sure you tilt the head, lift the chin, open the airway. 2 rescue breaths. And you'll begin again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 5, 26, 27, 28, 29, 30. 2 rescue breaths. 1, 2. Now, the music helps you with the rhythm, and that rhythm is very important. You need to be somewhere in the neighborhood of 30 chest compressions in 15 to say 20 seconds, no more than about 20 seconds, and really no less than 15 seconds. Now, it is important also that you understand, if you're alone with an adult and you are going to do CPR, you get help coming first before you begin. Now imagine that this is a child. If this is a child, not an infant now, if it's a child over the age of 1, the CPR is very similar, very much the same. However, it is important that we do CPR first before I contact 911. A child's not having a heart attack. A child usually has a respiratory problem that's caused their heart to stop. So therefore, we're going to begin CPR right away, at least for 2 minutes. Now, the only difference that you may have to do with a child is that you may only use one hand for chest compressions based on the size of the child. That's a judgment call. It's still on the nipple line, but one hand only so that we don't crush their chest. So I'd want you to demonstrate a few one-handed chest compressions for me. The rescue breaths are exactly the same for a child. Pinching the nose, head tilt, chin lift to open that airway. Now, for an infant though, CPR is a little bit different. First of all, with the chest compressions. Now, keep in mind that if it is an infant that is unresponsive and not breathing, we check it the same way. Hey, can you hear me? Can you hear me, buddy junior? Look, listen, and feel for about 5 to 10 seconds the exact same way. Have 911 coming. If you are alone with an infant, you're going to do CPR first before you even get help. Because again, they're not having a heart attack. Most likely it's a respiratory problem. Now, finding that middle of the chest, 3 fingers. Pointer finger goes right on the nipple line. The 2 fingers go below it. Lift that pointer finger and push straight down. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Rescue breaths are a little bit different. Your mouth covers their nose and mouth because of the size of their face. 2 rescue breaths, and you would continue doing that. Now, 1 time through, 2 times through is more than acceptable as long as you've covered all of the parts of CPR. Now, also what you're going to have to do in the video is you're going to have to tell me and show me what you're going to do for a victim that is choking. These victims were unconscious, an adult, a child, and an infant. Unconscious, unresponsive, which means it's implied consent. I don't have to ask them if I can help them. I can help them right away because they are unconscious. Now, if it's a conscious victim that is choking, most likely they're going to give you the international sign. You can tell that they're choking. First and foremost, you must remember to ask them if it's okay if I can help you. Are you choking? Can I help you? If they give you the head nod, which is acceptable, then you can help them by performing the Heimlich maneuver. If it is an adult or a child, what you're going to do is you're going to stand in a staggered stance with your knee between their legs so that you don't fall back. You're going to find their navel with your thumb, make a fist, the L portion of your hand, nice and firm between your forefinger and your thumb, makes that fist, hand over the top of it, and you're going to push in and up. You can do this in the video for yourself, demonstrating on you. In and up, those J motions help hopefully dislodge whatever is stuck in their throat. Now, one of 2 things are going to happen. Either they're going to spit it out and start breathing again, or they're going to lose oxygen and they're going to become unconscious. And that's when they become an unconscious victim. Call 911, begin CPR, minus the rescue breaths because we know that they were choking. Okay? You would do the same thing for a child, except that you may ask for consent from a parent or from a guardian that may be nearby. And a child has implied consent. I do not have to ask them to help them. I'm a teacher at a primary school. If a child is choking, I can jump right in and help them without having to ask anybody. It's implied consent, not expressed consent for a child. I may also have to get down on their level. Kneel, sit down, so that I can get the proper thrust for a child. Now, a choking infant is, again, a little bit different for a choking infant. If this infant is unresponsive and not breathing, I'm going to perform CPR. If they're choking, they're most likely going to be rigid and fighting, maybe even changing colors a little bit, their face would be red and that kind of thing, and their muscles would be very rigid. So what you're going to do for the infant is what we call the 5 by 5. You're going to take that infant, you're going to turn them over, support that head as best you can. You're going to be in a staggered stance. Your quad muscle, the upper part of your leg, supports that infant. And in the back, 1, 2, 3, 4, 5 back blows. You flip that child over, comfortable position, find the middle of the chest, regular chest compressions. 1, 2, 3, 4, 5. I'm also looking in the mouth for that object to come out. It is important that the baby's head is down because gravity is our friend here. We're trying to force that object out. You're going to continue that, 3, 4, 5, flip them over until you have either dislodged that object and the baby is breathing again, 1, 2, 3, 4, 5, or the baby becomes unconscious. If the baby's unconscious, we lay them down and we can begin CPR, make sure that we have 911 coming on the way. Okay? So it is important that you understand those steps. Certainly if you have any questions, let me know. It is going to be up to you to secure somehow the use of a mannequin from somewhere. From a police department, a fire department, a YMCA, you're going to have to get a mannequin. For the infant, it's okay if you use a baby doll, or if you use a puppet, or if you use a stuffed animal, that would be acceptable, I'd understand that. But for the adult, you're going to need the use of a mannequin for at least that portion of your video. And what I'll do is on the rubric, it is point system only, and I'm going to check off those points and all those that you hit. It's outlined completely on here so that you won't miss any step, as long as you know what's on the rubric. I hope this video helps, and if you have any questions, please let me know.